Hi, Dr. Pelto here. I want to talk today a little bit about a question that some patients ask me. They always ask me, are all wart treatments created equal? If I treat my wart and I Google it and I do everything they say in Google, am I going to get rid of my wart? And the answer to that, I think, is no, because what they put on the internet, even on YouTube videos, kind of like I'm making one, there are a lot of different types of treatments. Now, in my practice, I tend to see the ones that are the most challenging to treat. I see the ones that aren't getting better with traditional treatments. So I probably have a bias of difficult treatment. If you have a wart and you're sure it's a wart, and you maybe put salicylic acid on it, one of those like wart gone away or the freezing things, or you do duct tape on it and it goes away, then it was probably very mild wart. I tend to see the very, very challenging ones after everyone's tried all these treatments and they're not getting better. Once you've tried those ones, you haven't gotten better, and you have to put a timeline out there. I would say if it's not better in a couple of months, or if it's an area that's painful, you should see someone. What's the most effective or quickest way to get rid of it? So you want to activate your immune response. I guess the quickest way would be just to numb up the area and cut out the wart. So that would be like the quickest. But there's a chance of recurrence around the edges. So I don't tend to do that unless there's an isolated one wart and you're not a child, because the child really can't even tolerate that numbing. The quickest way to get rid of the wart, once again, besides cutting it out, is doing something called swift therapy. It usually takes less than 3 visits. It stimulates your immune response. Very, very effective. It's the quickest. But there are some are less painful. So for example, the less painful ones would be like a topical cream or topical salicylic acid. They're less painful, but the problem is they're less effective. Even though sometimes I think the more painful ones, like the Cantharidin, which doesn't hurt when you put it on, but blisters up afterwards, tends to be very effective, but it's painful afterwards. Laser tends to be painful when you do it, but not painful afterwards. And I think the last thing would be likelihood of recurrence. So even if you get rid of the wart, there can be a high recurrence rate. I think the reason for the recurrence is not so much it coming back, but more so that it never really went away. The research shows that the most beneficial treatment that has the least recurrence rate would be the swift treatment. It's microwave therapy that works really, really well.